All right, so we'll go ahead and get started. Today we're going to talk about developing safety policies and procedures. All right, so the agenda is we'll talk about the business case for safety, OSHA required policies, 4 elements of a successful safety program. We're going to also talk about some leading indicators, so putting that into your safety program, and then also wrapping up with a little bit on how to create a safety committee. All right, so making the case for safety. When workers stay whole and healthy, the direct cost savings to business include lower work comp insurance costs, reduced medical expenditures, smaller expenditures for return to work programs, fewer faulty products, lower costs for job accommodations for injured workers, and less money spent for overtime benefits. So safety and health also make big reductions in indirect costs due to increased productivity, higher quality products, increased morale, better labor management relations, reduced turnover, and better use of human resources. So employees and their families can also benefit from safety and health. Their incomes are protected because they're not injured and off the job. Their family lives are not hindered by injury. So if you have lots of hobbies, things that you want to do with your kids or your spouses, you're going to be able to do all those things when you're not injured. And their stress levels are not increased. So simply put, protecting people in the job is in everyone's best interest, our economy, communities, and our fellow workers, and our families. So safety and health add value to businesses, workplace, and our lives. So first off, we're going to talk about activities that OSHA requires a written safety plan for. So there's about, these are basically most businesses are going to have a few of these, if not all of them. I know there's a couple that are not. So OSHA requires a written safety plan for hazard communication. So it's a plan for facilities where workers could be exposed to hazardous chemicals. Failure to have a written hazard communication plan is a frequently cited OSHA violation. So you might think that your business doesn't have hazardous chemicals, but what OSHA defines as hazardous chemicals includes things like DEF fluid for diesel trucks. So it could be something that is technically not very hazardous, but it is classified as a hazardous chemical. So most businesses do need a HAZCOM written plan, an emergency action plan, and fire prevention plan. So you need to have an emergency plan and also your fire prevention. And under your fire prevention plan, it's going to include things like fire extinguishers, evacuation routes, and things of that nature. Bloodborne pathogens, exposure control plan. So facilities that anticipate employee exposure to blood. This is definitely things for healthcare facility, all healthcare facilities, but also when you have things that can cut you. So machine shops, they need a bloodborne pathogens exposure control plan because you can get cut very easily in a machine shop. So it's not just healthcare. HAZWOPER safety and health plan. This is kind of more towards the environmental side. So this isn't something that is as common. Respiratory protection program. So whenever you're required to use respirators, or if you have a program that allows for the voluntary use of respirators, even when your employees are voluntarily wearing them, if they're wearing a respirator, you have to have a respirator program. Hazardous energy control, so lockout, tagout. This is a program to prevent injuries during equipment service and maintenance. So any type of business that has any equipment that does need to be serviced and maintained, you need to have your lockout, tagout policy. And permit required confined space plan. So for any facility that allows entry to permit required confined spaces, if you have confined spaces that are permit required, they also have to be labeled. So this is a plan that's not going to be for everybody, but anytime you're entering a type of manhole or silo, things like that are considered a confined space, if it is permit required, you do have to have a written plan for that. So some of the basic safety plan elements. OSHA does recommend that each written plan include the following basic elements. So it needs to have the policy or goal statement, the list of responsible persons, hazard identification, hazard controls and safe practices, emergency and accident response, employee training and communication, and record keeping. So for the emergency and accident response, a lot of those are going to be very similar from plan to plan. The employee training and communication is going to be very similar from plan to plan. And the record keeping aspect is you always have to keep your records that you have trained your employees, that they sign off on that training. But then with the policy goals and statement portion, you want to have, this is going to come from your top management because that is very important that you have your top management commitment, and we're going to talk about that coming up. So 4 elements for successful safety and health programs: management commitment, employee involvement. So the manager or management team leads the way by setting policies, assigning and supporting responsibility, setting an example, involving employees. So it's leading by example. You have to have this. This might be one of the most important parts for having a successful safety program. The next is worksite analysis. The worksite is continually analyzed to identify all existing and potential hazards. This should always be ongoing, especially with our contractors and different trades. The job site is always changing, so you're always going to analyze and identify these hazards. When you have a fixed facility, a plant, or like I said before, a machine shop, it's pretty static. There's not a whole lot of changes, but when you enter new pieces of equipment, you might be doing something with a different process. That always needs to be analyzed so that you can pick out all of the hazards that are going to come from that. Hazard prevention and control. So methods to prevent or control existing or potential hazards are put in place and maintained. And then training for employees, supervisors, and managers. Managers, supervisors, and employees are trained to understand and deal with worksite hazards. So any type of program or policy that you put into place, you need to have a training on it. If your business has it doesn't have any safety programs and you want to start, the best thing to do is to start, do it piecemeal and get a couple policies in place. And once you have those in place, train your employees. You can do these during safety meetings because it doesn't take a whole lot of time to go through a bloodborne pathogens training, but whenever you do put a specific policy into place, there does need to be training. All right, so what I want to talk about next is probably one of the most important aspects of a successful program. It's management commitment. So number 1 is communicate your commitment to a safety and health program. Clear written policy helps you communicate that safety and health is a primary organizational value. It's as important as productivity, profitability, product or service quality, and customer satisfaction. So how do you accomplish this? You want to establish a written policy signed by top management describing the organization's commitment to safety and health and pledging to establish and maintain a safety and health program for all workers. So this is something that's typically on the next page after the cover of a safety program. It's going to be your policy statement, and it needs to be signed by the president and whoever else is included in that top management team. Communicate the policy to all workers at appropriate times and places and to relevant parties, including contractors, subcontractors, staffing agencies, and temporary workers on your work site, suppliers and vendors, other businesses in a multi-tenant building, customers that come into your facility. So you have a safety policy for your workers, but it's also important that you have anybody that's on site or anybody in your facility to follow these safety rules. So if you have a PPE policy, which most companies should have, and you have somebody that's touring the plant, you need to make sure that the person's touring that plant are following the PPE protocols, which is typically safety glasses, a high-vis vest, hard hat, sometimes steel-toe boots, but you need to make sure that everybody that comes on site or into your facility is following the safety safety policies that you have put into place. So continue with communicating your commitment. Reinforce management commitment by considering safety and health in all business decisions, including contractor and vendor selection, purchasing and facility design and modification. So be visible in operations and set an example by following the same safety procedures you expect workers to follow. Begin work meetings with a discussion or review of safety and health indicators and any outstanding safety items on a to-do list. So anytime you have a meeting, it's always good to open that up with something that involves safety, either something that is going, something that's going really well, something that needs to be sent down, that needs to be worked on. But it's not necessarily, you don't want to turn every meeting into a safety meeting, but it's always good to start those meetings with something safety related. All right, so number 2 is define your program goals. So by establishing specific goals and objectives, management sets expectations for managers, supervisors, and workers, and for the program overall. The goals and objectives should focus on specific actions that will improve workplace safety and health. So how do you accomplish this? You must establish, they've got to be realistic and measurable goals for improving safety and health. Goals emphasizing injury and illness prevention should be included rather than focusing on injury and illness rates. And we'll discuss this with when we talk about one of our next topics. So develop plans to achieve the goals by assigning tasks and responsibilities to particular people, setting timeframes, and determining the resources that are needed. Allocating resources. So management provides the resource needed to implement the safety and health program, pursue the program goals, and address program shortcomings when they are identified. So how do you accomplish this? I mean, it's pretty simple. You need to provide the resources that are needed to be able to implement your program. You also, it's not just dollar resources, but it's also time. So allowing time and worker schedules for them to fully participate in the program. Integrate safety and health into planning and budgeting processes, and align budgets with program needs. And provide and direct resources to operate and maintain the program, meet safety and health commitments, and pursue the program goals. So it's really important to establish your safety program, but if you're not providing the funds and also the time for workers to be involved, then you're not setting it up for success. And number 4, expecting performance. So management leads the program effort by establishing roles and responsibilities and providing open, positive environment that encourage communication about safety and health. So accomplishing this, identifying a frontline person or persons to lead the safety program effort, make plans, coordinate activities, and track progress, define and regularly communicate responsibilities and authorities for implementing and maintaining the program, and hold people accountable for performance. Provide positive recognition for meeting or exceeding safety and health goals aimed at preventing injury and illnesses, and establish ways for management and all workers to communicate freely and often about safety and health issues without fear of retaliation. So you want people to bring safety and health issues up. You don't want them to be afraid that they might be discriminated against or retaliated against because they're bringing up safety and health issues. That's what you want, because a lot of times you don't know that something's happening unless it's brought up by your employees. All right, so moving on to leading indicators. Leading indicators are proactive, preventative, and predictive measures that provide information about the effective performance of your safety and health activities. They measure events leading up to injuries and illnesses and other incidents, and reveal potential problems in your safety and health program. Whenever you have you're establishing or implementing a safety and health program, having something to measure that is going to allow you to prevent injuries is always better than looking back at your past injury rates, because those are things that have already happened and they're typically far removed from today. So lagging indicators measure the occurrence and frequency of events that occurred in the past, such as the number or rate of injuries, illnesses, and fatalities. So while lagging indicators can alert you to a failure in an area of your safety and health program or to the existence of a hazard, leading indicators allow you to take preventative action to address the failure or hazard before it turns into an incident. So we want to be proactive, we want to prevent these things and not just measure the bad things that have happened. A good program uses leading indicators to drive the change and lagging indicators to measure the program's effectiveness. So leading indicators, you're thinking SMART, so specific. Does your leading indicator provide specifics for the action that you will take to minimize risk from a hazard or improve a program area? Are they measurable? Is your leading indicator presented as a number, rate, or percentage that allows you to track and evaluate clear trends over time? Accountable. Does your leading indicator track an item that is relevant to your goal? So you don't just want to track random things. You want your goals, if your goals are 0 days missed from work, you want to be able to track that number because you don't want to track something that's not going to give you relevant information. Is it reasonable? Can you reasonably achieve the goal that you set forth for your leading indicator? And then timely. Are you tracking your leading indicator regularly enough to spot meaningful trends from your data within the desired time frame? We want things that are in the now. Things that in the past are always good. You can't necessarily predict the future, so you want things in a pretty condensed time frame. So this is an example. So a number of workers who attend, so the leading indicator would be a number of workers who attend a monthly safety meeting. Your goal is to have 97% worker attendance rate at monthly safety meeting. So when we talk about the specifics, does your leading indicator provide specifics for the action that you will take to minimize risk from a hazard or improve a program area? A good example of a leading indicator will be workers will attend a safety meeting every month. This is specific because it clearly identifies the activity and who needs to attend, so that your bad example is going to be saying that safety meetings will be held monthly. This does not give you, it's not specific because it doesn't give you who has to attend. And it is just a lot of companies say, well, yeah, we'll start doing a safety meeting every month. You need to be you need to drill it down a little bit further and say, who's going to attend that safety meeting? If you have 3 safety meetings a month, do workers need to attend 2 out of the 3, all 3? You need to be very specific with what you're setting up for your leading indicators to be. All right, so we're going to talk a little bit about a workplace safety committee, because any good safety and health program is going to include a workplace safety committee. So some elements of an effective committee are written bylaws. They're definitely a must. The mission statement narrows yet delineates the reason for the committee's existence. The size and structure emphasize the duties for members and the rotation of new members into the committee. Roles and functions create division of labor to achieve the goals of the committee. So you want to have a committee that has employees from different areas of your operation. You want to have supervisors in that meeting. And also, if any time the top level management can attend these meetings, it always is good for your employees to see them actively participating in your safety and health program. As far as rotating members, when you establish your safety committee, you want to set up a timeline for how long that member is going to serve on that committee. Typically, it's good for a year. You can, depending on how active your safety committee is, they can be 18 months is not unheard of. 2 years to be on a safety committee might be a little bit long, but you want other members of your employee group to be able to participate in this committee, and you don't want it to be the same group from day one until 5 years later. So you want this to be a rotating group where you're getting lots of different opinions and insights to what's going on with your operations. Effective committees. So there's members' responsibilities. What each member will be responsible for accomplishing can be assigned and measured. Management's responsibilities. So management has specific duties to ensure success. The meetings schedules allow members to plan their work schedules accordingly. Once you set this meeting, they should be set up throughout the year. You want this meeting on the calendar so that other things can be scheduled around it. And the agenda. So you want to have an agenda to structure the discussion topics and keep the meetings on track. A lot of times, safety committee meetings that I have worked with, an issue will come up and then it branches off into a bunch of different directions and nothing ever really gets accomplished. So having an agenda is very important to keep the meetings on track. So specific functions of a safety committee: review and updating safety training. So your trainings that you need your employees to have can take various directions. The committee can address the need for new or retraining opportunities. If there are incidents in the workplace, there might need to be some retraining done, or if employees are observed doing something a way they're not supposed to be doing it, this could be brought up in a safety committee meeting and you can decide how this is going to be addressed. Safety equipment and devices, they're engineering controls, and generally we want to use PPE first. So the safety committee is a good place that can address areas where engineering controls can be implemented. We want things to be affordable. You don't want your safety committee coming up with ideas that are so extravagant that it's just going to halt production. So this is a good area for them to brainstorm or bring up new ideas for establishing engineering controls instead of just having your workers put on PPE. Incident report reviews may lead to new operating methods and precautions which will enhance safety and not interfere with the organization's mission. So the safety committee should be reviewing any type of incident report. They can come to some conclusions and they can come up with possibly newer, better, or safer ways to do things from different insight, maybe from different parts of your organization. And reports and safety inspection reviews will permit a knowledge of the history involved with systems. So where past problems and failures were found and the remedies employed, you want to make sure that any type of suggestions or implementations that have been used from the safety committee, you're documenting these so that later you can talk about the success of your safety committee and it validates the time that they're using throughout the workday. And there also must be discussions of safety-related issues, either discovered during inspections or as reported by staff. So you can't just look at a report. You need to have a discussion, and you need to also talk about what is actually being found in your either the accident reviews, accident investigations, and you need to talk about how those are being done as well. All right, so some of the functions of the safety committee, they're obviously there to improve safety and health. It can involve short-term planning and long-term planning. If you have seasonal workers, before that those seasonal workers come in, you can review things with the safety committee so that you are prepared and having those seasonal workers trained and ready to go as soon as possible. Involving other employees in the safety function. So you want to encourage their thoughts and imagination and means to promote the safety effort. So a lot of times because you have a group that's working maybe remotely, there might be some better ideas to keep them safe from somebody that is looking at that group from the outside. Exploring what other safety committees are doing and generating ideas for consideration by the committee and staff. If you are able to network with other companies and find out what they're doing with their safety committee and some of the successes they have had, it's always good to bring in resources like that so that you can improve your safety committee. An improvement in employee and management relations is one of our main goals here, because when you have the lowest level employee working with your upper levels of management, it always is a good combination to have that morale and to have those employees feel empowered to be able to work with upper management with safety issues. and stimulating interest in staff that the improvements advanced are to their benefit, not only at work, but also home or when traveling. Whenever you're talking about safety issues, it's always good to remind your employees that whatever the safe operating procedures, the safe procedures that they're following at work can also be implemented at home, because we don't want our employees, you might have if you're a landscaping company, you might have a group of employees that are doing a lot of weed eating. You want to make sure that when they're doing their weed eating around their house, that they're still following those same safety protocols of wearing the proper PPE, and when they're working on their equipment at home, that they're still being safe so that they're not injured at home and not able to work. All right, maintain documentation of the committee's activities, which include meeting minutes, the members that are present, the issues discussed, recommendations of follow-up actions, training given to committee members. If there's an initial onboarding training that you want your committee members to take when they first start their stint on the safety committee. Inspection reports and incident reports and any corrective actions that are brought up by the safety committee. So the last thing we're talking about is 9 steps for implementing safety policies. So number 1 is always set safety and health as the top priority. Tell your workers that making sure they finish the day and go home safely is the way you do business. Assure them that you will work with them to find and fix any hazards that could injure them or make them sick. Leading by example. This is part of management commitment. Practice safe behaviors yourself and make safety part of your daily conversations with workers. Implement a simple reporting system. Develop and communicate a simple procedure for workers to report any injuries, illnesses, and incidents, including those near misses and close calls, because without a fear of being a fear of retaliation. So include an option for reporting hazards or concerns anonymously, and also make sure that you have a way to translate if you have if there's any type of language barrier, make sure you have a way to translate these issues to management. Provide training. So train workers on how to identify and control hazards. For example, OSHA's hazard identification training tool. It's a pretty good resource. It's like a lot of pictures that you can look at a picture, pick out the hazards. You go to the next one, and it'll tell you if you've got them right or not. So make sure your workers are they're trained, not just on safe operating procedures, but on hazard identification. Conduct inspections. So inspect the job site with workers and ask them to identify any activity, piece of equipment, or material that concerns them. Having checklists, there's lots of different checklists that OSHA provides, and probably your carrier provides as well. I can provide you with checklists that are very good, that are easy to go through and do a job site inspection. And collect hazard control ideas. So talk with workers about ideas on safety improvements throughout the project. Implement hazard controls. Assign workers the task of choosing, implementing, and evaluating the solutions. You want to empower your employees, not just your safety committee employees, but all of your employees to be able to implement and evaluate the controls that you're using. Address emergencies. Identify foreseeable emergency scenarios and develop instructions on what to do in each case. Meet to discuss these procedures and post them in a visible location at the job site. And make improvements. So you want to definitely set aside time to discuss safety and health issues with the goal of identifying ways to improve the program. Your safety program can always be improved. It can always be tweaked. Some say your safety program is a live and living document. That is true for a lot of things, but the safe operating procedures in a program should never be reduced to make things easier, because a lot of times that happens. You have a nice written plan, but it might take 10 extra minutes because you have an extra step that you've included for safety. You don't want to reduce your program to make things easier or quicker. All right, so to wrap it up, ensure that your policies and procedures match OSHA standards at the very least and are relevant to your operations. You don't want to purchase a safety, a bound safety program with policies that are totally irrelevant to your operation. And also remember that OSHA standards are the bare minimum. So we always want to try to strive to be above what OSHA is saying that we have to do, because the OSHA is at the bottom and we want to have more of a best practices policy. Writing your own safety policies, it can be daunting. Not a lot of people are going to be able to set out and have the time and the resources to just write a safety program. So reach out to your carrier, your producer, myself, for templates that you can take from, you can add to them. It's a lot easier because we're not, with safety, we're not reinventing the wheel. There's probably something out there that can help you pretty quick, but you do need to not, you don't want to request the policies, staple them together, write your company name at the top, and just set them on the shelf. You want these to be documents that are used and that they're followed and that your employees are living by to keep them safe. Stay compliant with OSHA's required safety and health topics. I think at the beginning of this, we talked about several of OSHA's required areas that have to have a written plan. Make sure that you're having those, the required topics that OSHA wants you to have in your safety policy. Management commitment is crucial for success when developing a safety program. If management is not committed and they don't provide the time and the resources, your program is not it's not getting set up for success. Leading indicators will help reduce incidents, while lagging indicators help measure the performance over time. So use those leading indicators to be proactive. And then establishing a safety committee can lead to insights that you need to address, or policies being updated that might have gone unnoticed. So there might be, for example, you might have something that is a step in a process that you've totally missed. This safety committee can bring these issues up because you're having your actual employees meeting and talking about safety. So my name is Michael Williams, and if you're looking for any resources, reach out to your producer or myself. We can help you get set up with your safety policies. Everything that I would send you is going to would be a template. There are things that you have to fill out, and you want to make sure that anything that you're requesting is going to be relevant to your operations. You don't want something that is just so far out in left field that it doesn't apply to you. Make sure that all of your safety policies and procedures are relevant to your operations. So thank you very much, and we'll see you next week.